Are you over 60 and waking up at night to pee more than you used to? Maybe you've started planning your day around bathroom access. Long drives feel stressful. Social events feel risky. You tell yourself, it's just age. But what if one simple daily habit is quietly making your prostate more irritated and your symptoms worse? Hi, I'm Dr. Rosalia Viterbo, a prostate doctor. I see men every week who are exhausted, frustrated, and sometimes even embarrassed by their urinary symptoms. They think it's all inevitable. They think nothing can be done. Often, that's not true. There is a very common habit I see in men over 60. It feels harmless. It often feels normal. You may even think it helps your energy or your sleep. But over time, it can inflame the prostate, worsen urinary flow, and increase nighttime trips to the bathroom. In this video, I want to talk to you directly. No scare tactics, no shame. Just clear, simple medical guidance. You'll learn what this habit is, how it quietly affects your prostate, and what you can do today to protect your urinary health, your sleep, and your confidence. If you've ever thought, I'm tired of this, or I just want to feel normal again, you're in the right place. Stay with me. By the end of this video, you'll understand your prostate better, and you'll know exactly what to change, step by step. Let's talk honestly for a moment. Most men don't like talking about their prostate. It feels private, sometimes even embarrassing, so you stay quiet. You tolerate symptoms, you tell yourself, I'm fine. Other men have it worse. But your body keeps sending signals. You notice your urinary stream is weaker, you stand longer at the toilet, you feel like you never fully empty your bladder, you sit back down on the couch, and minutes later you feel the urge again. At night, it's even more obvious. You used to sleep through the night. Now you wake up once, then twice, sometimes 3 times or more. Your sleep becomes broken. Your energy during the day drops. You feel more tired, more irritable, less focused. This doesn't just affect your bladder, it affects your mood, your confidence, even your relationships. Maybe you avoid long trips. Maybe you say no to social events. Maybe you worry about leaking or not finding a bathroom in time. And in the back of your mind, there's another thought. What if this is something serious? But then another voice says, you're overreacting, it's just age. So you adjust, you change your routine. You cut back on certain activities, you live around your prostate. As a doctor, I see this pattern all the time. Men normalize discomfort. They ignore early warning signs. And they keep certain habits that quietly irritate the prostate day after day. Sometimes it's what you drink. Sometimes it's when you drink. Sometimes it's a relaxing evening habit that feels helpful in the moment, but silently worsens inflammation and urinary symptoms over time. Have you noticed that some days your symptoms are clearly worse, or that certain evenings always lead to a restless night? That's not random. In many cases, there is a clear link between daily habits and prostate irritation. And the good news is this: once you understand the habit, you can change it. And when you change it, your prostate often responds. Gently, gradually, but very clearly. Now let's get very clear. The habit I'm warning you about is regular evening drinking, especially alcohol close to bedtime, even if it's just 1 or 2. For many men over 60, this is automatic: a glass of wine with dinner, a whiskey to relax, a beer while watching TV. It feels normal. It feels harmless. It may even feel like it helps you unwind or fall asleep, but inside your body, something else is happening. First, understand what alcohol does to your bladder and prostate. Alcohol is not just a relaxing drink. It's a diuretic. That means it makes your kidneys produce more urine. So when you drink in the evening, your body makes more urine right when you should be winding down. Your bladder fills faster. Your brain gets the message, time to pee. Now, if you're 25 with a small, healthy prostate, you might not notice. But if you're over 60, your prostate is often larger. The urethra, the tube your urine passes through, is narrower, so you have more urine, trying to move through a tighter channel. That means more urgency, more frequency, weaker stream, more nighttime trips. Alcohol can also irritate the bladder lining. Think of it like a sensitive skin rash inside your bladder. When that lining gets irritated, it becomes more reactive. You feel the urge sooner and more intensely. If your prostate is already enlarged, this extra irritation adds another layer of discomfort. Does this mean alcohol causes prostate enlargement by itself? not directly, but it worsens the symptoms of an already enlarged prostate. And for many men, that's what they actually feel every day. Second, look closely at when and how you drink. I'm not here to judge or lecture. My goal is to help you understand patterns. For many men, the problem is not only what they drink, it's when they drink. Imagine this pattern. You have a drink at 7 p.m., another around 9 p.m. You go to bed at 10:30 or 11. Your body is still processing that alcohol. Your kidneys are still making extra urine. Your bladder is filling while you're trying to sleep. You fall asleep, then wake up at 1 a.m., feeling full. You get up, pee, go back to bed. At 3 or 4 a.m., it happens again. Now your sleep is fragmented. Your deep, restorative sleep is cut short. The next day, you feel tired, less sharp, less patient. Over time, this affects your mood, your energy, even your desire to be intimate or social. So what can you do? Try this simple shift. If you choose to drink, move it earlier in the day, with lunch or an early dinner, not late at night. And reduce how much you drink overall, especially on nights when sleep is important the next day. Some men notice a big difference by doing just one thing: no alcohol within 3 to 4 hours of bedtime. Your bladder gets a break. Your prostate feels less irritated, and you often wake up fewer times at night. Third, don't forget about caffeine and total fluids. Alcohol is the main habit I'm focusing on today, but it often comes with friends. Many men have coffee in the afternoon, tea in the evening, maybe a soda with dinner. Caffeine, like alcohol, can irritate the bladder and increase urine production. If your evening looks like coffee at 5 p.m., tea at 8 p.m., a drink at 9 p.m., your bladder gets hit from multiple sides. So, in addition to cutting evening alcohol, look at your total fluids after 6 to 7 p.m. Here's a simple plan. Drink most of your water earlier in the day. After dinner, sip, don't chug. Avoid large mugs of tea or big glasses of liquid before bed. Limit or avoid caffeine after mid-afternoon. You're not depriving your body, you're retiming your hydration. Your kidneys still get the water they need, but your bladder isn't overwhelmed right before sleep. For many men, this combination, less evening alcohol, less late caffeine, and smarter fluid timing, leads to noticeably fewer nighttime trips within a few weeks. Fourth, support your prostate with daily habits. Alcohol and fluids are only part of the picture. Your prostate also responds to your overall lifestyle. A few key points. Weight. Extra weight around the abdomen increases pressure on the bladder. Losing even a small amount can ease symptoms movement. Long hours of sitting can increase pelvic congestion. Gentle walking, stretching, or light exercise helps blood flow. Constipation. A full rectum behind the prostate can worsen urinary symptoms. Fiber, water earlier in the day, and regular bowel habits all help. None of this has to be extreme. You don't need to become an athlete. You don't need a perfect diet. But small, consistent changes give your prostate a healthier environment, and that makes every other step more effective. Finally, know when to see a doctor. Adjusting your evening habits is powerful, but it doesn't replace medical care. Please see your doctor if you notice blood in your urine, pain, or burning when you urinate, sudden worsening of symptoms, fever, chills, or difficulty passing urine, unintentional weight loss, or feeling generally unwell. These may be signs of infection, stones, or sometimes more serious problems that need proper evaluation. Even if your symptoms are mild, getting checked is wise. We can measure your prostate, check your urine, discuss medications or other treatments if needed. Think of lifestyle changes and medical care as partners, not opposites. You take care of your daily habits. We guide you with tests, follow-up, and treatment options. And together we protect not just your prostate, but your sleep, your energy, and your confidence in daily life. Remember, you are not being fussy or weak by paying attention to this. You are taking responsible, proactive care of your health, and that is something to feel proud of. Let's take a deep breath and bring everything together. You're not just dealing with an annoying bladder. You're dealing with a sensitive prostate, an aging urinary system, and habits that quietly affect both. For many men over 60, the pattern is the same. More nighttime trips to the bathroom, weaker stream, feeling like the bladder never fully empties, broken sleep, low energy the next day. It's easy to blame age and move on. But as we've discussed, age is only part of the story. The habit I warned you about is regular evening alcohol. especially close to bedtime. It acts as a diuretic. It increases urine production. It irritates the bladder. And when your prostate is already a bit enlarged, that extra irritation can dramatically worsen your symptoms. Then, if you add late caffeine and large amounts of fluids in the evening, your bladder gets pushed even harder. No wonder you wake up multiple times at night. So what are your key steps? First, become aware. Notice how your symptoms change on nights when you drink versus nights when you don't. Pay attention to timing. What happens when you stop alcohol 3 to 4 hours before sleep? Second, adjust your routine. Shift any alcohol earlier in the day if you choose to drink at all. Limit or avoid caffeine in the late afternoon and evening. Keep evening fluids light and gradual, not heavy and rushed. Third, support your prostate with lifestyle. Move a bit more. Avoid sitting for very long stretches. Prevent constipation with fiber and good bowel habits. Work gently toward a healthier weight if needed. And finally, don't ignore warning signs. If you notice blood in your urine, pain, fever, or a sudden change in symptoms, see a doctor promptly. Remember this, your body communicates with you. Your prostate is not bothering you on purpose. It's sending signals that something needs adjusting. Always listen to your body, and don't feel embarrassed to seek help. As a doctor, I would much rather see you early when changes and treatments are simpler than later when you've been struggling for years. You deserve restful sleep. You deserve steady energy. You deserve to feel confident leaving the house without scouting every bathroom. Small changes today can make a real difference in how you feel tomorrow and in the years ahead. If this video made you pause and think about your own habits, that's a good sign. It means you're listening to your body. You don't need to change everything overnight. Start with one small step. Maybe tonight you skip that late drink. Maybe you move your fluids earlier in the day. Maybe you simply pay more attention to how your body responds. As a prostate doctor, I can tell you this with confidence. Men who take these small changes seriously often feel real improvements. Better sleep, less urgency, more control. And with that comes something very important, more confidence and peace of mind. If you found this explanation helpful and you want more calm, clear, doctor-led guidance on men's health, I invite you to stay connected. You can subscribe to this channel for more videos like this. We'll talk about prostate health, hormones, energy, intimacy, and everyday habits that quietly shape how you feel. You don't have to navigate this alone. I'm here to guide you, step by step. Thank you for spending this time with me. Take care of your health, take care of your sleep, and I'll see you in the next video.